Hello guys, and welcome to part 2 of my presentation on GLAD and osteoarthritis. Now, this is a follow-up presentation from last week. So if you had missed that, I'm sure the superpowers at Westgate Health will organize a way to get you the recording. So don't feel like you're out of place if you missed last week's presentation. It'll be all made available. Plus, on the interwebs, online, you can jump online. There's a recording on YouTube. So feel free to check that out as a point of reference. All right, now I'm happy to answer questions as we go, but be mindful at the very end of my presentation, there's a chance to ask any questions, and I'm happy for you to lob any curly whirlies at me. I'll give it my best go in answering any concerns or questions that you have. Yes, so with that, let's dive in. And I will minimize this. All right, guys, welcome to part 2 of our GLAD presentation. This session is largely focused on safe exercise for the osteoarthritic population. So if you're here, you're most likely interested in learning about what the do's and don'ts are, and this presentation will walk you through that. Okay, now, why should you consider listening to Lecky? That's who I am. I'm actually the physiotherapist here at Westgate Health, but I've been practicing for 13 years now, graduated from Melbourne University, very strong sports physio background, fortunate to travel around the world. My background is from Polynesia. I'm from Tonga, raised in Australia, educated in Australia, but we play rugby. And I might be in the wrong state, but a lot of contact injuries, a lot of experience in private practice, being with a very big mob in West Melbourne with Symmetry Physio for a number of years, and then now building and establishing my own business across 7 locations in Melbourne, which has been great. My focus now, being 36-year-old young fella with a family of 3, is on chronic disease personally, and my view on thinking about chronic disease as an older Australian in minimizing that in my own personal decision-making has allowed me to upskill myself in the management of chronic disease. One such chronic disease is osteoarthritis, which is why we're here today, and hopefully I can help you with today's information. Again, just another plug, if you missed part 1, there's a recording available online which you can review, and that was taken last week. Alrighty. Let's keep moving along. So this is a chart or a table, and this pyramid pertains to the treatment pyramid regarding osteoarthritis. Now, the treatment guidelines from around the world, based on recent strong evidence, some strong scientific research, emphasizes the importance of early treatment, which involves education, exercise, and weight control, if that pertains to you. Okay, this is what we call the first line of treatment. If you have osteoarthritis signs, this is basically what you should be considering, okay? And the treatment options should be presented to you. Other treatments may be helpful, which is the second line of treatment and third line, but they should be complementary and should not replace the first line of care, okay? Really important. Now, we talked at length about this last week, so feel free to review that. But today I'd like to talk about the exercise component for the osteoarthritic population. Okay, next slide, here we go. All right, so there are 2 types of exercise that I'd like to present before you today, okay? General exercise for the general population, and then therapeutic exercise, which I'll talk about in a moment. Physical activity is good for everyone, and staying active is an important part of managing osteoarthritis. Physical activity can occur during leisure activities, things that you enjoy like sport or walking, or occupation activities, i.e. your job, whether it's a white-collar job in the office or a blue-collar job being outside. Now, you may not have control of your load that the body undergoes at work or leisure activities. That's the big deciding factor. So, for example, carrying a box heavier than your fitness level can handle may lead to pain and injury, okay? Big alarm bell. Another example may be trying to keep up with friends in a walking group who walk faster than what you're capable of. Exercising to get stronger and improving your fitness level can also help you deal with things better than what you may need to or want to. So as a general comment, physical activity is good for a general population, okay? But what may pertain to you and your circumstance is therapeutic exercise. And this is where the mismatch can occur, because you may feel or think or have been given advice for this guy, physical activity, when really you need this guy, therapeutic exercise, which is carried out for a specific purpose and can be guided by a health professional and can improve your ability to be physically active in work and leisure time. So what does that mean? So therapeutic exercise is designed to work on many things, and I've listed them out down here. But neuromuscular exercise, which is a fancy word for nerve muscle exercise, is a big primary focus for our GLAD program, which can improve the way that you move and give you more confidence when you do exercise. So in the GLAD program, for example, exercises are completed to improve muscular endurance and strength, along with your ability to perform common functions like standing from sitting or walking up and down stairs, which I know can be a big problem for the osteoarthritic population in the knee and in the hip. Exercises can also be given to improve muscle power, which means you can generate force quickly. So, for example, lifting the box or a heavy pot of stew if you're cooking. You know, these are very functional tasks that we complete every day. They may also improve your balance and your ability to do activities which require more muscle power, like running, if you've got to cross the street, or if you're running to catch a train, or if you're running to catch up after the grandkids. You know, these are very real things that we all have some semblance of in our day. The exercises within GLAD can improve flexibility with a stretching regime to help you with your joint range of movement, plus aerobic activity. So it puts your heart and lungs under a bit of stress with, say, a walking program or a bike program. And this can help improve your physical fitness, which can assist you in getting back to your level of, or your desired level of physical activity. Now, again, I know I'm laboring this point about appropriate exercise because we're trying to differentiate between the two, but you can turn your daily tasks into therapeutic exercise with the right physical, with the right professional supporting guidance. So, for example, walking to the shops instead of driving may help improve your physical fitness, or you may choose to walk a certain distance that's comfortable to you in a faster time, which makes your heart beat faster, makes you feel a little bit more short of breath, which is a form of aerobic exercise, which I'll touch on in later slides, is going to be helpful for not only this primary chronic disease, osteoarthritis, but with other conditions as well. So within the GLAD program, we are looking at the function and the structure of your specific parts and pieces. So we emphasize, for example, sitting to standing movement and how it's performed. Like, are your joints aligned? Do I load my joints in an optimal way? Do I contract my abdominals before to help stabilize my body? You know, whether you're completing these tasks appropriately will help ensure the longevity of your hip and knee joint. Okay, so I hope that makes sense and that I've defined that. So moving to this slide here, we're talking about movement is medicine. Exercise or physical activity is medicine because inactivity increases your risk of at least 35 different chronic diseases. Now, in the clinic here at Westgate Health and across our physio locations, it's not uncommon that someone that presents for an osteoarthritic problem also has a few other things that they're trying to manage as well. Some of them here are listed below, but there are many positive effects from being physically active. It helps lower your blood pressure. It improves the way your body handles your blood lipids and cholesterol and managing, stabilizing your blood sugar levels. Better physical fitness reduces how tired you feel. And I spent some time talking about fatigue in part 1 of this presentation because feeling tired and fatigued is a metabolic condition. It's not due to your muscles and bones being weak. So that's why addressing chronic disease through physical exercise can help improve your energy, help improve and fix the fatigue problem, if that's something that you're observing. Your body will improve the connection and control of your muscles. So, you know, they'll help allow your joints to be better nourished and stronger. It will help you with bone density. So if osteoporosis is a concern, physical activity actually helps, which I'll walk you through in this presentation. And as explained in the previous part 1 session, cartilage actually needs the dynamic load. So it needs the pressure on the joints to actually remain healthy, the cartilage. And so your appetite and body energy metabolism is affected with exercise. So exercising might increase your muscle mass, get bigger, stronger muscles. And as your muscle weighs more than fat, you might actually see an increase in weight. So just be mindful of that. But having more muscle is better than having more fat, or the unhappy fat, which is linked to other positive health effects. So exercises also increases the feel-good endorphins released by the body, which enables less pain and better mood. So we love exercise. It's good for you. And here are the reasons or the recommendations that we would suggest. As guidelines in Australia recommend 150 minutes of moderate, so it should feel slightly difficult, or 150 minutes of exercise per week.
You mean I get the same now?
Or if you have 75, let me just, excuse me here for a moment. Perfect. Sophia, if you could just press mute, please. Oh. Thank you.
I have no idea what I'm doing.
Ah, there we go. Sorry, guys. Okay. My point here. So recommendations. Let me start again. Recommendations for physical activity, just to give you a bit of a compass on what would be appropriate as you're thinking about your own sort of lives week to week. The guidelines from Australia recommends 75 minutes of vigorous physical activity per week, 75 minutes, or 150 minutes of moderate exercise. So if you look at a continuum, if you're going sort of at your own pace, sort of roly-poly, 150 minutes of moderate, slightly stressful exercise per week is ideal. Or if you're going for 75 minutes of vigorous activity per week, that'd be ideal as well. You'll receive further benefits by completing more vigorous activity. And generally, we encourage 30 minutes of exercise per day. So at the very least, you're looking at 150 minutes of lighter exercise, ideally 75 minutes per week of vigorous work. But optimally, we're encouraging 30 minutes a day. Okay, I hope that makes sense. So a simple aim is to complete 30 minutes a day of physically active exercise. And we'll walk through what that looks like. So importantly, exercise should be completed in bouts or blocks of at least 10 minutes. So exercise should be completed in intensity where you start to feel a bit sweaty. You feel the sweat on your brow. You start to feel slightly short of breath. This means that the endorphins, or the hormones that give you that natural high, will be released, and you start this adaptation process to get stronger and fitter. So to help improve your physical fitness, you're looking to work at about 60% of your maximum heart rate. Now, quick maths here, if an easy way to calculate your maximum heart rate is to subtract your age from 220. So if you are looking at my number, say if I'm 20 years old, then I would be looking at a heart rate 60% of 200. And that would be giving me an idea of what I'm aiming for if I'm looking at my smartwatch. So if you think, another way to think about this is if you're going for a 100-meter sprint, that's 100 meters, 100% perceived effort. We're asking that you work at about 60% of that 100% effort, okay, with the physical recommendation. So a leisurely walk is great, good place to start, but ideally we're wanting something where you're pushing the pace a little bit more. For some people, 30 minutes a day may seem a long way off, absolutely fine. It may be helpful to start with a smaller initial goal. So for example, most people that we see with severe knee arthritis, for example, complete 10 minutes of the moderate intensity walking exercise as a form of exercise per day without increasing their pain. So if you set a goal of a 60-minute a 60% threshold of effort, and you have a 10-minute time of that effort, and you're persisting with that as your baseline, that's a great place to start if you're finding that the arthritis that you're managing is quite troublesome. So as a potential thing to think about, doing something is always better than doing nothing. Now, what can you do to stay active? A whole lot of different things depending on what you enjoy and how you respond. Because programs like GLAD can help build your capacity to be active and achieve your physical activity goals. Now, it's important to find activities that you like and enjoy, and so you can fit it into your daily life, so it can help you prioritize regular physical activity. Because no one likes doing something that they don't enjoy. So, for example, I may not enjoy swimming, so it'll be a hard task to ask Lecky to go and swim regularly, but I do enjoy walking, I do enjoy cycling. So the same thing pertains to you and what your decision may be. Here are some examples or a variety of activities to consider. Walking is a simple activity. Start with small distances and gradually increase. I'm going to walk through the science at a macro level on why this is important, to start small but persist, rather than trying to go in full bore too soon. It just is a recipe for disaster. Later, as you increase your walking tolerance, you may start to increase your speed as well. So not just distance, but walking speed increases too. So that's a great way to progress as a way for you to meaningfully stay active. Running is something that people often avoid with osteoarthritis. Now, this is controversial, so just, there's a caveat here, if I could just put a little star there. We're not discouraging running. However, the evidence to suggest a small amount of running is harmful is very, very weak. So we're not discouraging running. Just be sure that it's something appropriate to you and your health. So ensure that you work towards building capacity to run through the therapeutic exercise that I was speaking about earlier, and gradually introduce running. Because some people may not have run for many, many years, but after a GLAD program or a specific strengthening program, over a period of time, weeks, months, maybe sometimes even years, people can start to find that they've got bandwidth to think about running. So it's not too far gone if that's a goal that you're thinking about. Cycling is very effective in improving your physical fitness because there's less joint load than walking. You're non-weight bearing. You're pushing through the pedals, the hips happier, the back's back happier, the knees happier. Just be sure that your knee allows a comfortable bend of 110 degrees, because if you think about the cycle or the revolution of a bike, when you get to the bottom of that of the pedal, your knee should be bent, say about 20 degrees, a slight bend. So when you get to the top of the revolution, the knee should be bent about 110 degrees. So just adjust your seat height because it's very friendly for the knee and hip, but just make sure that the saddle is friendly. Swimming is another exercise, much like running or water aerobics, which can be a great form of physical activity, and it places a lot less load on the hips, your knees, your back, and your feet. Dancing is awesome. I enjoy dancing. You may not have picked it, but dancing is a great form of physical activity and is enjoyed by many people. Again, start slowly and increase over time. Just be careful with alcohol and that sort of thing. Obviously, we want to make sure that it's enjoyable and that you don't lose balance and cause more dramas. So talk to your physiotherapist about exercise strategies to improve your capacity for dance, but we love dancing. Aerobics, again, helps improve strength, stamina, your coordination. So wear proper shoes and be sure to be careful of jumping and sudden changes in direction. And like all things, start slowly. And with strength training, it has many, many benefits. So in fact, in the guidelines, we recommend within our GLAD program 2 strength training sessions per week due to the benefits of improving bone density, balance, your cardiovascular health. If it's guided and supervised, inexperienced people can become great in terms of proper technique and improving their strength profile. And programs should be progressed every couple of weeks because you often get stronger. And if your programming stays the same, you reach this threshold where you get stale, basically. Your body needs to be challenged, and that's how you get stronger. So whether you're choosing to walk to the shops or, if it's a brisk walk or if you're negotiating stairs, as always, trying to do something is better than doing nothing. All right, now this is a slide that's borrowed from the first presentation. And again, a little reminder that this is strongly supported. This guideline of education, exercise and weight control is a clinical practice guideline published by the Royal, the RACGP, is an acronym that stands for the Royal Australian College of General Practitioners. So the guys that run the GPs, the doctors, they're saying that this is recommended as for Australians seeking care for osteoarthritis should be offered exercise as point number one, as the starting point. And so the GLAD program offers a great option to provide this. Now, this is a key slide from, again, borrowed from the first presentation, and it's talking about cartilage health. Now, we're moving away from using descriptive terms like wear and tear of the cartilage, because osteoarthritis is much more than just the cartilage as the primary structure that's pathological, okay? But the cartilage anatomy is actually really important, because it is true, if you start to lose the cartilage, it's irreplaceable. You can't grow new cartilage, unfortunately, but the cartilage needs to be appropriately loaded to be healthy and regenerate itself. So when it's loaded and unloaded, the fluid that sits within the capsule of the knee that nourishes the cartilage, it's like a sponge. So when you load the cartilage or load the knee, the fluid is sucked into the cartilage, so it nourishes and smooths the cartilage structure. Then what happens is when you're non-weight bearing, it draws and sucks the fluid out of the cartilage, and that's how through repeated loading and unloading, it improves the health of your cartilage. So the stimulation of cartilage growth improves by the shock absorption capacity. So if you hear this and you try and do too much weight bearing load, but your strength isn't at a level to take on that dynamic function, you will start to imbalance the process here, and that's when it becomes painful and pathological. So that's where the advice and supervision becomes really important, by having a good professional in your corner. So inactivity from excessive loads, from say hard manual labor for many, many years, or some elite sports athletes, can cause an imbalance between the development, like the stimulation of the cartilage and the degradation of the cartilage. So the load is really important. Like it sounds like you're tippy-toeing on this tightrope where, you know, you want to do enough, but you don't want to overdo it. And that's why it's very individualized, the way that you manage your bone health. So starting to exercise earlier in the piece has a greater effect on the development of the cartilage, because it will save the severe stages of osteoarthritis at the back end. So the things that you practice or that you are doing and getting good at, if you're increasing the joint range of your knee on your hip, if you're stimulating the strength around the muscles that support these joints, then the knock-on effect is you have an easier way, it'll become easier to perform everyday activities, and you're happier, which is why we're here. We want to be happy with happy joints and living a happy life. Okay, so I've been hinting about exercise and what the GLAD program, what does it actually look like? Well, in short, exercising how much, the dosage is important, because having strong muscles to stabilize the joints improves your confidence to help you complete the activities you need to be successful within your day, whether it's walking from A to B, negotiating stairs, in and out of the car, chasing after kids, grandkids. We all want happy joints. And using the right muscles at the right time, i.e. coordination, makes it easier for you to control your movements and complete functional tasks. Because if you have an unhappy knee and you are actively avoiding certain movements, you are going to compensate, and next thing you know, your hip gets out of whack, or you start to have a sore back, or you're getting weird problems in your feet. So that's why we're talking about alignment, and I'll touch on that as we go. So it's important to give your body time to recover and rebuild itself between exercise sessions. That's why we spread out the actual GLAD training sessions over the week, so that you get there and you get a really good exercise session safely. Then you have a little rest period. then we throw you in again and continue to work on your supervised exercise classes. Okay, so you actually get the benefit of the exercise during the recovery periods. When you rest is actually when you get the growth or the improvement. Now, in terms of exercising, what we're looking for, what we aim for is great alignment. And that's what neuromuscular exercise. Neuromuscular basically means nerve muscle exercise. So the muscle doesn't work on its own. It's through the brain and nerve connection. And it's a two-way street. So when we are giving information to the joint and the muscle, it feeds the nerve endings, tells the brain, okay, Lecky, you're using your knee in this plane of movement. This is what we want you to understand as the new normal. And if you continue to feed the brain this information, you achieve this alignment and you distribute the forces more evenly across the knee, which is great. If you look at this guy over here on the right, compared to this guy on the left, you can just already assume that parts of the knee are going to get quite overloaded. It's going to be quite unhappy. Imagine if the chassis on your car, the axles in the car were this wonky. Your car would break down. Okay, and I'm not being jovial about this. I'm just saying that it's just, these biomechanics, these laws of physics, the car can't escape it, and we can't expect our bodies to escape the laws of physics too. So, sorry, just off on a bit of a tangent there. So, the neuromuscular approach for exercise is effective in reducing pain and improving confidence in most people with osteoarthritis, even those in the population who are about to have a joint replacement. So even if you are that far along where you are looking to have the surgery because of different reasons, this actually is a great way for you to get longevity out of your joints post-surgically, because this is most likely the reason why this came about, was the actual movement dysfunction, because we weren't so strong in certain areas. If we correct them, then post-surgically, you preserve the health of the prosthesis. Okay, so regardless of where you are in the race, exercise is going to play a part in the longevity of your joints and your happiness. Okay, how much? Now, I touched on this point earlier. We're just laboring the point again. Like any treatment, exercise needs to be adequately dosed. So when you see the doctor and you get a prescription for medications, they give you a recommendation on what's appropriate to take. Okay, if you're cooking a recipe, if you're making some pancakes, there's adequate doses of different ingredients to get the best pancake. The same thing applies to exercise. So I think having this mindset of getting really busy and trying to perform these great exercises may not be appropriate for where you are in your stage of the race. So that's why dosage, we pay a close attention to what you're seeing subjectively, like how you're feeling, and objectively what we see, like this Mr. Crooked over here. So we recommend careful dosage. In the GLAD program, we recommend 2 supervised exercise sessions at the minimum. And we find that 3 to 4 times per week is likely to be more effective, but we start with 2 because it's for consistency. If we're looking at a commitment, 6 weeks should be the minimum period for an exercise program to give it a chance, give your body a chance to allow it to work, because this term called adaptation, the body is brilliant at adapting at the stimuli you throw at it. So research shows that shorter exercises, so in duration, less than 6 weeks, doesn't allow enough stimuli to improve your strength and to make those great adaptations. So the best exercise is the exercise that really gets it done. So again, when I go back to the examples of different types of exercises, it needs to be something that you can see benefit from and something that you enjoy. So whether it's a 10-minute walk a day, aiming for about 70 minutes of exercise per week, or if it's bike riding, whatever it may be, start somewhere and just persist, because that 70-minute effort per week becomes 60 hours a year, which even at a slow speed becomes well over 200 Ks in a short period of time. So I think it's those small steps done consistently rather than trying to sprint to the finish line. Now, this is one of the most important slides in this talk here. So this is really the reason why we pay attention to dosage, because it's important when starting a new exercise or a program not to do too much too soon. And programs like the GLAD program allows you to modulate your load safely, so that instead of being this top graph, we're here on the bottom graph, because we're learning the correct amount of load, which is very individual. So it's customized to you. And the right amount of load will help you get stronger and improve the health of your cartilage and the health of your knee, because each person needs to learn the correct amount of loading. So as you get trained up in the appropriate exercise for you, you achieve more self-awareness, you're taking an ongoing view of how you're performing and how the knee's responding or the hip is responding. Then you have this measured break between the exercise program. Then you can adjust your program again. So that's why the measured breaks in between each of your exercise sessions, because that's where the improvements happen. So if Lecky starts here and then I want to run a marathon, and yeah, I'm feeling really good, the endorphins are flying, but I haven't trained to run a marathon, I'm going to be in a lot of pain and I'm going to crash. Then I'm going to see something on Facebook or YouTube that I really want to try and do this gym program. Then I go 100 miles an hour, then I crash. Then there's something else, and you can see that I'm just on this roller coaster and my poor body hasn't had a chance to adapt. Versus Lecky over here, which starts with a 10-minute walk every day at a pace that's at 60% of my max. And then I just slowly start to maybe increase the distance over the next 2 weeks. Then maybe I keep that distance and I increase the speed. And you can see that it's a smoother improvement. I'm giving my body a chance to adapt and get stronger. And that's what allows my bone health to stay with my level of function. So you want to be able to improve the resilience of the body by giving it the time. Okay, so if we're looking at the load here, so over time, as you're loading up the joint, you actually get more durability as you put reasonable load through it. And then what happens is you can start to get less cartilage durability if you're starting to trail off in your exercise load. So load and cartilage is interchangeable because they help mediate each other. If you're not putting enough through the joint because of pain or weakness, it's kind of like a backward thing. You're actually making your osteoarthritic joint worse because the cartilage isn't getting the nourishment from the load. Okay, so very important point. Now, this leads to the most important slide in this presentation, which is pain doesn't often equal damage. And it's almost like a reprogramming of our brains, because yes, pain is an alarm signal in the body to protect ourselves from ourselves, because because that's an innate system that we're programmed into. So it's vital to understand this, that pain doesn't equal damage. Now, pain is a companion to osteoarthritis because it often hurts when you start exercising. Absolutely understand. And it's okay to hurt when you exercise to a point, to a limit, because humans are hardwired to treat pain as a warning signal. However, within osteoarthritis, this can prevent pain. This can prevent people from exercising. Just got a quick question here. No worries, Nina. No worries. Now, firstly, pain during exercise must be perceived as acceptable. Think of it as just notes from the trenches. When you're in the wars here, you're trying to get as much information from the environment so you can make better decisions. So number one, pain during exercise needs to be perceived as acceptable. Oops. Secondly, any increase in pain during or after exercise should subside after 24 hours. Okay, so that's an important note. This same guideline has been used by thousands of people with osteoarthritis to help take control of pain when exercising. And it's been shown that repeatedly, the more exercise that you do, the less pain that you will eventually have. Because exercise is dose dependent, that we spoke about before. And in this case, over time, more is better. Pain doesn't originate in the knee. pain is created by our brain based on different factors, which we touched on in our presentation last week, which can be influenced by your thoughts, your feelings, your experiences, and your beliefs. Have you often wondered, for example, when you hear bad news, like someone close to you has passed away, and you feel physical pain? That emotional stimuli presents to you as a physical pain, which is what we can see here, because the thought of climbing 10 stairs with your knee pain mentally already almost produces the pain in your knee because it's trying to save you from yourself. But with careful dosage and exercise prescription, you can build the tolerance so that when you don't have pain, that fear and that almost that mental barrier starts to turn down the noise of that alarm bell that's ringing. Does that make sense? So that's why we're suggesting that the holistic view of managing osteoarthritis is not just the muscle and bone stuff, it's also the intangibles. Okay, so if we were to look at a sliding scale here where 0 is no pain and 10 is the worst pain, we would be looking to be exercising somewhere between a 5 or a 6. So we can see here as you start to go from orange to red, we don't want that. We don't want to be safe because you're not putting too much load in there. And I don't mean safe like, I'm just saying if your load is too low, as we've shown before, we actually want to load the joint safely to acceptable level. So that way, this moderate, if we're looking at this analog scale, 5 to 6, aim for that. Whatever that means to you, 5 to 6 out of 10 of pain is a great guide to aim for. Okay, now understanding your barriers to exercise, because when we're asking some of these participants about what your barriers may be, there's lots of different solutions. Now, finding time in your everyday life is a big barrier because we're all busy with the things that we're up to, completely understand. So having something that you can plug and play to your day, that's why enjoyment has to be a big thing you factor in. So without interfering with your everyday plans. I think motivation and seeing the purpose and knowing the importance of exercise is really important, because pertaining to pain, that may be a barrier to weight loss because the pain is blocking me from exercising, therefore I can't get this weight off. You know, it's kind of like an equation we can all understand. So if you can move more thoughtfully and with less pain, your motivation to achieve other goals like weight loss skyrockets. So writing down your goals to motivate yourself, very important. In GLAD, we measure how long it takes for you to walk 40 meters as a measuring stick when you start the program, and how many times you can sit to stand over 30 seconds. So these are objective measures so we can get a guide of how you are at the beginning and at the end of the program. But there's other ways to check your improvement. There could be like an exercise time of how you walk around the house, a timed effort, or how you go negotiating up and down stairs. So be prepared for times where you may see minimal or no improvement. And that's where the support comes in, because if you're trying your most earnest and you're not seeing the results, it may be for a few different factors. But this happens to everyone, even higher level athletes. They get very frustrated when they put all this effort in and they don't see improvement. So we're treating you like high level athletes in that we have to give you real world accountability and also realistic guidance on what's appropriate and specific for you. So it's a good plan to plan. It's a good plan to strategize ways that you can handle disappointment, even if you're being really good with being consistent. So having someone that you can access to give you support and allow you to make adjustments with the exercise program, or someone to answer your osteoarthritic questions, is the reason why the GLAD program is quite good, because it's supervised exercise. So the physios are right there to assist you. Having knowledge in the structure and function of your joints is important, plus the exercise that's appropriate for you and the dose prescription. And we're not looking to bag anyone or anything like that, but if you try and do the right thing and head to a gym and you're given generic exercise and it actually makes you worse, this is the reason why therapeutic exercise versus general exercise, one of the earliest slides in this presentation, is really important, because it needs to be specific for you. So remember, the best exercise is the exercise that gets done. So just find the one that suits you best. Now, Again, with exercise being vital, I know this whole presentation is mainly on exercise. Remember that it takes a lot to damage your muscles and your joints, and being active just doesn't help osteoarthritis. It actually helps with up to 35 other chronic diseases like depression, cardiovascular and heart disease, diabetes, and your risk of falling. So physically active, very, very important. Do something that can be like a strategy to divert your attention from the pain. So questions that you may ask yourself is like, can you remember a time where you forgot the pain because you were preoccupied with an activity? So I don't know, let's say you're walking down to get the paper and you would be hyper-focused on your knee pain, but then one day you find with an exercise program that you're not focused on the knee pain, you're not hyper-focused on the actual hip problem anymore or knee problem. And that's how you know that you're starting to turn the corner. So using activities as a measuring stick on how you're performing is a great task. Like, can you tolerate standing, cooking your Weet-Bix in the morning? Can you get up a flight of stairs and down a flight of stairs? So this is a good way to help you cope with the pain if you're noticing these little hurdles that you're jumping over, and patting your back along the way and celebrating that. So I guess what we're trying to incorporate here is having a healthy relationship with your pain, because creating a plan and sticking to your plan will help you stay active. Man, I feel like an inspirational speaker here. So, okay, so 3 types of coping strategies. This is what we would recommend. If you have used any of these strategies, like number 1, stop if there's pain, continue like you did before, or modify and do things differently. So if there's something that you have stopped doing because of your knee or hip pain, that's a coping strategy. And that may be a good short-term measure, but over the medium to long term may not be the best idea. So because other structures will be put under pressure, not only will the knee continue to decondition and degenerate, as you've learned, because it actually needs the load, it needs that support. So we encourage that you continue to modify. So stop. If you're good enough to continue as before, proceed. If you're not going so well, then we can modify. So it's a good strategy to make sure that you have someone in your corner to give you the appropriate advice. Okay, guys, you're doing really well. A couple more slides. Now, here are some things to consider to stay active. If you are using supportive aids or devices like an insole, if you've got a gait aid, great. If you have other devices like a smartwatch, so you can keep track of things, because if you can measure it, then you can see, whether you should go left or right. I think taking breaks, as you've learned before, having those breaks, even mini breaks in between the exercises are great, or having the breaks in between exercise events are really where you improve, and that's how you get stronger and achieve adaptation. I think if you are looking at complex movements at home or in the exercise program, you can break it into smaller parts. So if you're gardening, instead of being out there pushing it out for a 2-hour gardening session, maybe break it up into half-an-hour blocks. Okay, something to just help reduce the load on the joint. Find other ways to modify the way that you're working. Try and ask for some help to lower the demand on what it is that you're doing at work. Perhaps if you're doing a bit too much walking, or if you're bending, lifting, pushing, pulling, trying to do tandem lifting, things like that to preserve your joints. And also putting your hand up and asking questions, asking for support, really important. Okay, now, a couple of last points here is self-management tips. This is really a big self-awareness game, because it's going within yourself and just taking it's like you're in the car and you're reading the dashboard in the car. When you switch it on, the engine's fine, need some oil, and that's what you're looking to achieve here with daily exercise, because it's an evolving battle almost. We'd love to have it straightforward, but it is a bit of a roller coaster in the sense that it needs to be carefully managed. So things to help you with self-management is just aim for something small but consistent, and you're aiming for something daily. If you can make it enjoyable, even better. Try to avoid prolonged sitting. I think, as they say, sitting is the new smoking. So if you can avoid the prolonged sitting, that'd be great. If you're looking to set a mini goal and you achieve that mini goal, reward yourself, pat yourself on the back, because these things should be celebrated because it keeps the momentum, so you can move forward. Take charge of your own disease. Now, if this is a chronic disease issue that you have, so it's just the osteoarthritis, take charge of it, own it. But if there's other concurrent comorbidities that you're managing, again, it's just understanding what you can do for yourself. So if we can tick this box for osteoarthritis to some degree, it'll give you better bandwidth to help manage diabetes or help formulate a plan to reduce the cholesterol readings or whatever they're finding in your blood tests. So again, I come back to this self-awareness. Listen to your body, relaxation techniques, monitor the way that you're moving, getting strong, staying strong. Avoiding limping is a big one because these are learned behaviors. I like using this metaphor of walking with a pebble in your shoe. If the pebble's in your shoe, you're still going to walk uncomfortably, but you're going to change the way your foot strikes the ground. Okay. And that's fine. You can still walk, but then your calf is going to start to get a bit tired. You're going to put your back out because you're walking a bit wonky. So when we're looking within the GLAD program at alignment, this really helps in your general gait patterns. So it's a positive movement pattern that we're after. Okay. And if it pertains to you, optimal body weight is really important. And that's complementary to the GLAD program. So remember, education, exercise, and weight control. So in conclusion, you made it down the home stretch here. It pays off in the long run. If you ever think about anything that you've mastered in your life, you didn't wake up one day and decide you're going to ride a bicycle. You fell off a couple of times. You needed some support. You need mum and dad to hug you a little bit. Then next thing you know, you're off and riding a bicycle. Same thing here with exercise. You need that support. You need that guidance. You do need to understand that you're pushing the envelope a little bit, but the pain gauge is 5 to 6 out of 10. And this is specific to you because your 5 or 6 out of 10 may be different to mine, different to Bob's and Jane's. Okay, so hang in there, be consistent, start with small steps, but just be patient with yourself. GLAD is a specific program for hip and knee conditions and the treatment of osteoarthritis. And just understand that everyone is different and you know what is best to you. So listen to your gut, listen to your intuition, very important. Develop your own specific goals and plans. Talk to your physiotherapist. I'm here if you need me at Westgate Health. And there are referrals to other health professionals like a dietitian or specialists if that pertains to your particular problem. So with that, I would like to thank you for listening to me talk namely about exercise here today. And I'd be happy to answer any questions. I hope you found today's session enlightening, and I'll pause for a moment to answer any questions. Thanks, guys. Great. Thanks for your feedback there, Kerry. No problems at all. In terms of making an appointment, so right here in Westgate Health, our physio, so myself being the physiotherapist here, we don't have the space for the group training program. So I offer one-to-one sessions. So I offer basically the same program within GLAD, but between you and I, and we can formulate a specific program for you and your health needs. Thank you, Tony. Appreciate the feedback. Now, I'm happy to pause. If anyone wants to unmute and ask a question, please fire away. How long do we go for? About 45 minutes. Wow. Longer than I thought. Okay. If you didn't want to unmute, feel free to pop a question in the chat. As that may be happening, thanks for the feedback about the presentation. I really appreciate it. Thanks, guys. Okay, I would say, let me give you a real world example today. I saw a youngish fellow, 42 years old, busy dad. He's an executive, middle to upper management, 42 years old, so he's young. And he has osteoarthritic signs in his knee. He noticed he was carrying a bit more weight than he would like to admit. And he has a very busy work, so imbalanced with lifestyle, and he admits it. I saw him for the second time this morning. I saw him initially last week. Could not get up and down stairs without pain. In the morning, his first couple of steps, very painful, getting out of bed. And after some testing and our session last week, I gave him 2 simple things that he needed to do in bed, okay? Non-weight bearing, so off his stomach, and with a little resistance band. And the exercise was completed just once a day, so 15 minutes max, 15 minutes. 42-year-old fella. He came back this morning because he was waiting to see a specialist this Friday, organized by the doctor. He came back this week 80% better, no pain up and down stairs, and just really happy. He cancelled his appointment with a specialist. Now, I'm not trying to sort of paint this as a, I'm just reporting to you how it goes with simple exercise prescription, because I led with education and exercise specific to his needs. I didn't tell him to go and run a marathon or lift heavy weights in the gym. After the assessment, I said, look, start with this exercise, big fella. And then he was a good student, did what he was asked, and he came back and he's a lot happier. So don't outweigh the importance of great advice and education, because your situation to the 42-year-old fella's situation is different. So I'd craft a specific advice for where you are in your stage of the race. Okay, so I've got a question here from Susan. So GLAD is an acronym that stands for Good Life with Arthritis from Denmark. And it's because the GLAD protocol, which is an international program, it's run across the whole world, started by 2 professors in Denmark. So it's actually driven by La Trobe University here in Australia, and I got trained in this program in October. So feel free to just check out that recording from last week, Susan. Kerry, yes, at the moment at Westgate Health, I'm here running one-to-one sessions. The group settings are great because you can bounce off other people's energies, and who doesn't like being in group atmosphere. In the recording from last week, I sent you to places where you can search on the Google platform, on the GLAD platform, for providers. So there are physio clinics or people who are trained in GLAD that may be close to you. So I'm not saying you'd have to come and visit me here. Like, I'm a pretty approachable fella, and if you prefer to be in a group, we don't offer that here right now. So, but you can find a local group in the inner western suburbs of Melbourne or all across Australia. So check out the recording, just fast forward to the end and you can see those resources. Thank you for your feedback, Catherine. Appreciate that. No worries, Robin. Happy to help. And Kerry, yes, I also, oh, sorry, I've answered that question. Cool, guys. All right. If anyone had any verbal questions, I'm happy to take them. Cool. I'll just throw one last case study at you. I had a very, very pleasant 88-year-old lady. She's awesome. I think she fancied me a little bit too, which is cool. But she was actually referred internally by one of the doctors here at Westgate, and she has this back pain, hip pain, knee pain, and she's at a great stage in her life, and there's a lot of degeneration. We understand it can be challenging. I gave her some simple programming, very different from the 44-year-old. And again, an improvement of about 30 to 50%, her words, not mine. But for an 88-year-old lady who needs to be independent, reduce her risk falls, chances of falling, within a turnaround time of, I think, 3 or 4 sessions within 4 weeks, for her to verbally tell me that she felt 50% better and more confident in her own independent space. She lives it with her husband in her own home. That makes me happy because it allows her to live her best life with her husband at home without the risk of falling and less pain. So I can come up with heaps of these war stories. If you have any questions, feel free to reach out. And I think I'll be presenting next week. So just keep an eye out for, it's going to be on shoulder pain. And the following, I think I'll have one last session, which will be on low back pain the week after. So I hope you guys find this helpful. And yeah, I like to present information in a lay way because we're all simple creatures in the end. So
you just answered my question, because I was going to ask about lower back pain. So thank you.
No problems, no problems. So I'll address them. Thanks for your question there. And if you guys have any questions at all, feel free to reach out. I'll let you run away to the rest of your Wednesday. Thanks, guys. I'll see you soon.
Thanks a lot. Bye.
Bye-bye.
you. Bye.